Hello everybody, this is Dr. Sharat Chandra Goteti. I'm a consultant medical oncologist and hematologist at Medicover Cancer Institute, HITEC City. Today we are here to speak about a very important topic relating to ovarian cancer. As you all know, ovarian cancer is on the rise in the last 1 or 2 decades. The incidence, as per latest reports, is around 20,000 new cases in our country in the whole year. So we'll speak about how to identify this at the earliest, what will be the warning signs and symptoms, when to approach a doctor, and how to make yourself ready for the diagnosis and the treatment, if at all. So ovarian cancer, the symptoms are very subtle. It can be very vague, let's say a vague abdominal pain, vague abdominal distension, bloating, some difficulty in passing urine sometimes when there is pressure on the bladder and everything. Early satiety, meaning fullness of abdomen after a little meal. So the symptoms can be very vague and subtle. As such, there are no straightforward screening tests to diagnose ovarian cancer before any symptoms. But you need to be in regular contact and touch with your let's say a general physician or any other doctor or even an oncologist at times. So whenever there are any such warning signs or symptoms which I just spoke about, you need to consult your doctor and get an initial test like ultrasound abdomen plus pelvis and a blood test like CA-125 to begin with, and then the further tests taking from there. We'll also talk about when to be more careful if there is any positive family history in your family. So if there is any family member who is already diagnosed with breast cancer or ovarian cancer in your family or your immediate generations, it will be wise on your part to discuss your risk with your oncologist. So not every person who has a positive family history would be at risk, but there are some certain features and tests which needs to be done to assess your own risk. So it would be a good idea for you to know your family history in particular and in detail, and then assess your own risk to be on the safer side. So just do not ignore these subtle symptoms like vague abdominal pain and distension and early satiety. Being in touch with your doctor and evaluating these initial warning symptoms would go in a long way to diagnose these abdominal cancers like ovarian cancers, which is a great masquerader, as we call it in our oncological terms, to diagnose at a very early stage. So that's all. Thank you.